This video has been developed collaboratively by the Podiatry Board of Australia and the Australian Health Practitioner Regulation Agency, or AHPRA. It focuses on prevention and control of infection during a visit to a podiatrist. The same principles apply when visiting a podiatric surgeon. Effective infection prevention and control is central to minimising the risk of the spread of infection. It's everybody's responsibility and helps keep the patient, the health practitioner and the public safe. The key things you should look for when visiting a podiatrist are: does the podiatry clinic look clean and tidy and have a smooth, easy to clean hard floor covering? Is your podiatrist wearing appropriate clean clothing and, when required, wearing protective equipment such as gloves, aprons or a mask? Does your podiatrist have a sink in their clinic where they can wash their hands? Are the instruments clean or new and disposable? When you go to see a registered podiatrist, you can be safe in the knowledge that they have met national standards, such as continuing to learn to develop their knowledge and skills.
Peter Williams.
Yeah.
Hi Peter, I'm Tanya Rhodes. I'll be looking after you today.
The single most important factor of infection prevention and control is hand hygiene. If your podiatrist's hands are visibly soiled, they must complete the correct hand washing procedure prior to treating you. If their hands are not visibly soiled, an alcohol-based hand rub is sufficient.
It takes around 40 to 60 seconds to complete the hand washing procedure before your hands are ready to examine a patient.
It's not just the podiatrist's responsibility to minimise the risk of infection. As a patient, you are also encouraged to exercise good hand hygiene and disclose health and risk status if you believe you may infect those around you.
So Peter, I'm ready to take a look at your foot. Are you happy for me to proceed with the examination?
Yes, of course.
When the podiatrist undertakes an assessment, they may use some instruments, such as a monofilament, a reflex hammer or a tuning fork. These instruments are always thoroughly cleaned before and after use.
They don't need sterilising because they're only used on intact skin or where there is no risk of causing broken skin. Okay, we'll get started in a moment. I've just got to put on my protective clothing.
Personal protective equipment, or PPE, refers to barriers used to protect you from infectious agents. The PPE worn by a podiatrist can include an apron or gown, a surgical mask, eyewear, and gloves. The wearing of this protective clothing is a routine part of infection prevention and control in healthcare. Hand preparation and PPE for podiatric surgical procedures is more stringent, so it will differ from the procedure outlined.
Well, I just need to prepare the instruments and we'll be ready to go.
Sterile instruments are needed for any procedure that touches broken skin or has the potential to touch broken skin. The podiatrist may use single-use disposable or reusable sterile instruments. All instruments used by your podiatrist will be sterile and trackable to individual patient use. Because both you and your podiatrist are at risk of infection or injury when using sharp instruments, such as needles or scalpels, used disposable sharps must be discarded into an approved sharps container at the point of use, immediately following the procedure.
Reusable podiatry instruments such as nail clippers are sterilised in an autoclave. This destroys microorganisms on the surface of an instrument or device to prevent disease transmission.
Once your treatment has finished, your podiatrist will remove and dispose of single-use PPE and surface barriers used during your visit.
Once I remove my protective clothing, it's important that I perform the hand hygiene procedure one more time.
To prevent the spread of infection, your podiatrist will also clean shared clinical equipment and touched surfaces with detergent solution between patients. This includes the patient chair and treatment trolley.
Infection prevention and control is critical to the health and safety of both practitioners and patients. It is taken very seriously by your healthcare provider. If you have concerns or complaints about your podiatrist or podiatric surgeon, you should contact AHPRA.
You can be safe in the knowledge that all registered podiatrists and podiatric surgeons are meeting their professional obligations. Check your podiatrist is registered at www.podiatryboard.gov.au.